Hey, and welcome to another episode of the Trans 101. Today, we are going to be talking about top surgery. Now, there are two main types of top surgery. I will be talking about one of them in this video, and then the next video we'll be talking about another one. In this video, we're going to be talking about double incision. So top surgery is actually a nickname that almost everyone in the community uses. It's so much easier than just saying double incision or double mastectomy or surgery on your breasts. So top surgery has become the kind of go-to slang or nickname that everybody kind of uses in the community. The most basic definition that I can give you is the removal of the breast to masculinize the chest. So in this specific type of surgery that I'm talking about, double incision, it's also known as double mastectomy, so that you are literally removing the two breasts and there will be two incisions across your chest over here, and they usually do nipple grafting. I know this is complicated, so let's break it down. So this surgery is for people who have larger breasts, okay? Usually it's like people who are B and up, and then people who are on the smaller spectrum would get the other surgery that I'm going to be talking about in the next video. I can't tell you which surgery your chest and your person will have. You need to talk to a surgeon because some surgeons only perform one specific type of surgery on all patients and all of that. So I can't be the one, but I can tell you exactly what double incision is. So basically what happens if you have breasts, they're going to make an incision on top over here, and then they're going to make an incision underneath. Then they kind of just remove that breast tissue and they sew the two pieces together. I know that sounds super simple, but all right, what happens is that they also contour the chest. You have pec muscles, and they make sure, a lot of surgeons make sure that the scars are going to be under the pec, so if you ever develop pecs or you have developed pecs muscles, the scar will be underneath. This is different for a lot of surgeons. Some surgeons don't do that. Some surgeons' scars are lower, some are higher, some are up here. Everyone has a different method of doing it, but the most common way of doing it is that people will have scars here that don't usually touch. They touch for some people, and they go across the chest over here. And then what happens to the skin that's up here? Well, you get nipple grafts. So with the nipple graft is they take your original nipple that you had and they cut part of it so that it can look like a smaller nipple and a nipple of a cis male, and they will install it on your chest. Now, the biggest question that everyone always has, I feel, with top surgery is, will I lose sensation in my nipples and in my chest? So with this type of surgery, they are cutting the nerves away from the nipple and they're not connected to the nipple anymore. So that means that you will lose sensation. Not everyone loses sensation. A lot of people still regain sensation, or the type of sensation that they have wasn't the same as they had it originally, but you can regain sensation. I have had this type of surgery. I was very scared to lose nipple sensation. If I touch my nipples now, I can literally feel them. It feels great, and I am 4 years post-op surgery now, and it has taken a long time, but when I touch it, I actually can feel my nipple, and it feels really great. The sensation is completely different than it was before I had surgery, but at least I know that I can have some sensation. But you kind of learn to adapt with your body. I have a lot more sensation under my nipple, which is very strange for me. So especially if you want to talk about erotic sensation, under my nipple is more than my nipple for some reason. So our bodies are weird, nerves reconnect everywhere, but that's basically what happens with the sensation. Some people have numbness on their chest. That can usually come back within a year. There are just some areas on my chest that are a little bit numb, but almost everyone that I know that has had top surgery can feel almost all of their chest. Now, there is a type of surgery very similar to this one that you can retain your nipple sensation. It's called the T-anchor. Now, with this surgery is they do the same thing. You have the scars on the side, and then you have two scars that are under the nipple that connect to the nipple and then down to the scars. That's why T looks like a T, the T-anchor, and then an anchor, I guess. So with this is they actually keep the nerves connected to the nipple. Now, there is some issues that come along with that. Some people have said that because if they had very large breasts before top surgery, that means that the nerve connected to your body and to the nipple is very long. So when you have surgery, they're not cutting the nipple, they're not cutting the nerves. So that means that when you have surgery and you have a flat chest, some people have said that they can still feel the nerve because now it's kind of like all kind of squished up, and it kind of feels like a fluid pocket. Some people have said that that's not for everyone. If you have smaller breasts when you have surgery, then you probably won't feel that, but just try to imagine it. There's a long string and then you're kind of cutting everything down. Where does that long string have to go? It has to go somewhere. They're not cutting it and reconnecting it, right? So there's always gonna be that long. So especially if you have bigger breasts, the connection's always, it's gonna be longer. So That surgery isn't very popular, but it is another type of surgery that you can have. So how old can you be to have this type of surgery? Well, the youngest person ever that I know personally in my life is 16. Yet I have heard some people who are younger who have had top surgery. Now, there are not all surgeons will perform surgery on minors, okay? For example, there's one doctor, Dr. Garamoni, who is the surgeon that I went to. He will not perform surgery on minors. Other surgeons like Dr. Fisher and Dr. Crane will perform on minors, obviously with parental consent. Of course, another very popular question is, how much is top surgery? Well, the cheapest top surgery that I've ever seen was probably around $3,000 American dollars that we're talking right now, and then it can go all the way up to like $11,000. The surgery that I have now costs at this moment in 2017 $6,500 with the surgeon that I went with. Now, is it covered by insurance? If you are in America, all right, and you have insurance, some insurance plans will cover top surgery, but not all surgeons accept insurance. So you really need to shop around for the type of surgery that you want, the type of surgeon, and the type of insurance that you have, just to make sure that all of those align. I am not American, so I cannot give you specifics on insurance, so if you ask me specific questions about it, I'm sorry, I will not be able to answer those, but I just wanted to give you kind of an overview that yes, it can be covered by insurance in America. Now, so I live in Canada, so I know that you can get it covered here. There are different ways that you have to do it through different provinces, so I'm not going to go through all of those, but that's something that you could look up, and I'll put as many information links that I can in the description, just so that you can kind of understand how one would pay for surgery. So what is recovery like for double incision surgery? Well, so many surgeons use drains. So the drains basically come out of the incision that you have here. They come out here. Some surgeons have drains, some surgeons don't have drains. Basically what the drains do is they drain out the excess fluid that you have from surgery so that there's no buildup. Now, some surgeons don't use drains because they found a way to encompass, I believe, the muscle so that the fluid kind of just regenerates into the skin and into the muscle and into your body, so you don't need to drain it out. So how long do people usually have drains for? Well, you usually have drains for about 5 days. I've even seen up to 10 days. I had personally had drains for 5 days. When they removed it, I didn't feel anything. Literally, it did not feel like anything. Other people have said that when it has been removed, it was extremely painful. That was one of the things that I was the most scared about top surgery when I was 15 and 16, realizing that I'm trans. So when the moment came where they took out the drains, it was literally nothing for me, and I felt such relief. And if it does hurt, it only hurts for half a second, and honestly, it's worth it to drain out what you need to drain. Usually people will have bandages, so you need to change your nipple dressings, and you'll have a type of binder that you need to put on. Sometimes it's a binder that has a Velcro, sometimes it's a vest, and other times I've seen it's an ace bandage over here. So they put an ace bandage around you, and you just need to put that. Now, the reason why you would have a type of vest on you is really more to protect yourself. Some people think that it's so that your chest will remain flat. They already took everything that wouldn't make you flat, so you don't have to worry about that. But really, it is a good idea to keep it so that you are protecting yourself from infection and from other people. Example, I wore it to a wedding 3 weeks post-op. I don't recommend going to a wedding 3 weeks post-op. Don't do that. My best friend was getting married. I was part of the wedding party. So I had to put my bandage on, and it was a little uncomfortable, but I would much rather have that safety than knowing that somebody could bump into me. And recovery is usually about 6 weeks. Some people it's less. Other people can go back to work after 3 weeks. Other people can exercise after 4 weeks, but usually the surgeons are telling you you can go back to work, you can resume normal activities after 6 weeks. What is the quality of life after top surgery? Well, I cannot speak for other people, but I will put myself into this Trans 101 right now and tell you that my life has improved so much since having top surgery. I had a lot of top dysphoria where I felt so disconnected from my body, and I binded for years and years and years. More on binding in a different episode that you can go take a look at. And after having top surgery, I just finally felt like I was me. I was the person that I was meant to be my whole life. I look in the mirror and I finally see who I am. It's not 100% gonna solve all the problems in the world that you have, but for me, it made me feel so much more comfortable in my person and in my body. Anyway, so that's it for this video on double incision method of top surgery. The next video we'll talk about keyhole or the peri-areolar method of top surgery. If you would like more information on any of these things, please look at the description below, and I'll see you soon.